Unit 7. Physiology and Injuries in Sports. By Mr. Manpreet Singh. Content: Physiological factors determining components of physical fitness. Effect of exercise on muscular system. Effect of exercise on cardiorespiratory system. Sports injuries. Classification: soft tissue injuries, abrasion, contusion, laceration, incision, sprain and strain, bone and joint injuries, dislocation, fractures, green stick, comminuted, transverse, oblique and impacted. Important terms: Physiology: study of science of how the human body functions. Sports medicine: sports medicine is a branch of medicine that deals with physical fitness and treatments and prevention of injuries related to sports and exercise. Main components of physical fitness: strength, speed, endurance, flexibility and coordination. Physiological changes due to exercises. During and after we perform exercise, there is an impact on all these components on our body parts and its functions. Physiological factors determining the component of physical fitness: strength, speed, endurance, flexibility. Muscle composition: size of the muscle, intensity of the nerve impulse, body weight, gender. Muscle composition: explosive strength, mobility of nervous system, flexibility, biochemical reserves and metabolic power, elasticity and relaxing capacity of muscle. Muscle composition: lactic acid tolerance, movement economy, aerobic capacity A, oxygen intake B, oxygen transport C, oxygen uptake D, energy reserves. Age and gender. Muscle strength, stretchability of muscles, anatomical structure of joint, internal environment, previous injury. Benefit of regular exercises: reduces risk of vascular and heart disease, improves the function of lungs, strengthen and bones and joints, helps in weight control, relieves mental stress and betters relaxation, improves fitness and endurance, better quality of life. Immediate effect of exercise: respiratory. Times breathing rate increase, times air inhale increase, times blood flow through lungs increase, times increase in oxygen collected, times increase in carbon dioxide removal. Cardiovascular. Times heart rate increases, times volume of blood pumped increase, times blood pressure increases, times keep muscle supplied with oxygen, times removal of waste carbon dioxide from muscles increases. Muscular. Times oxygen supply to muscle increases, times heat is generated, flushing out by sweating. Effect of regular exercise over time. Respiratory. Times respiratory muscles stronger and more efficient, times vital capacity, times growth of capillaries around alveoli, times allow you to train harder and longer. Cardiovascular. Times heart enlarges slightly, times red blood cells number, times artery walls elasticity. Musculoskeletal. Times muscles, tendons grow strength, times growth of capillaries around muscles, times muscles more efficient at using O2, times ligaments strength, times range of movement in joints, times bone strength. Long-term effect of exercise on cardio. Respiratory cardiovascular system. Reduced risk of heart diseases. Cardiac hypertrophy. Decrease in resting heart rate and quick recovery rate. Stroke volume increases at rest. Increase in cardiac output. Increased blood flow and blood volume. Decrease in blood pressure. Short-term effect of exercise on cardiorespiratory cardiovascular system. Increase in heart rate. Increase in stroke volume. Increase in cardiac output, increase in blood pressure. Increase in blood flow. Effect of exercise on muscular system. Change in shape and size of Muscle. Formation of more capillaries. Strength and speed. Controls extra fat. Makes respiration easy and effective. Efficiency in movement and energy supply to muscles. Delays fatigue. Better neuromuscular coordination. Muscle hypertrophy. Increase in the speed of deoxygenated blood towards the heart. Coordination BW group of muscles. Improves. Reaction time. Sports injuries. Common in the field of games and sports. Sports injuries refer to the kinds of injury that occur during sports or exercise. Some injuries happens while playing sports or performing exercise due to accidents in the play fields, or poor training practices, or wearing improper gear, or if warm-up is not done properly before main play, etc. As each nation is behind the race to achieve medals in international competition, this is possible only when physical fitness is maintained by preventing sports injuries. For this purpose, knowledge of treating and preventing injuries is needed for a specialized branch of medicine SEM in sports medicine. Games and sports can also result in injuries, which may be minor, serious or even lifelong medical problems. Young athletes' bones, muscles, tendons and ligaments are still growing, which makes them more susceptible to injury. Like in the growth plates, coaches shall make groups of athletes according to their skill level and size, but not the chronicle age, particularly during contact sports. Classification of sports injuries. Soft tissue injuries occurs to the connective tissue. Contusion, strain, sprain, abrasion, laceration, incision. Bone injuries. Direct and indirect impact of external force on the bone. Simple fracture, compound fracture, complicated fracture, green stick fracture, comminuted fracture, impacted fracture, stress fracture, transverse fracture, oblique fracture. Joint injuries. Majorly found in freely movable joint. Dislocation of joints such as lower jaw, shoulder joint, hip joint, wrist. Soft tissue injury. Soft tissue refers to tissues that connect, support or surround other structures and organs of the body, the muscles, tendons, ligaments, fascial, nerves, fibrous tissue, blood vessels, etc. Soft tissue injuries involve injuries to muscles, ligaments and tendons in the body, classified into two groups: major serious soft tissue injury, which are big injuries, or open wound, minor soft tissue injury, which are minor in nature. Preventive measures of soft tissue injuries: 1. Proper warming up. 2. Proper conditioning of body. 3. Scientific equipments and facilities. 4. Clean and plain surface of playgrounds. 5. Knowledge, rules and regulation of sports events. 6. Actively and alertness participation during the sports training and competition. 7. Fatigue, sickness and injuries condition to avoid the participation in the sports training. Major soft tissue injuries. Contusion, an external injury caused by the blow or impact, without breaking or rupture of the skin. Strain, an internal injury of tendon muscle caused by the stress over the muscles or overstretch them beyond its normal limit. Sprain, an internal injury of ligament at the joints like wrist joint, ankle joint, etc. caused due to overstretching or twisting of a joint. Minor soft tissue injuries. Abrasion, an external injury on skin caused by falling on and rubbing against a rough surface. Incision, an external injury, cuts made by sharp objects, blades of knife. In this, blood vessels, capillaries can get damaged. Laceration, an external injury, a direct blow on the skin causes the skin to tear off, especially from point where bone structure underneath are of prominent. Abrasion. Symptoms treatment prevention. Scrap or rub on skin, avoid further friction and infection. Proper warm-up should be performed before training competition. Burning pain, clean the part with antiseptic cream or soap and clean water. Wear protective gear as required. Some bleeding at abrasion spot, cover with medicated cotton or bandage. Repeat the dressing and clean the part every day till it heals up completely. Abide rule and regulations of sports activity. Anti-tetanus injection to be taken within 24 hours. Maintain playfields and courts. If severe pain, some painkiller may be used. Unbiased officiating helps in preventing injuries. Minor injury, external injury, skin is scraped or rubbed by friction, serious only if some foreign matter is stuck into it. Incision. Symptoms treatment prevention. Pus, do not scrub or soak the wound. Proper warm-up should be performed before training competition. Bad smell coming from the wound, clean the part with spirit when open wound, and if a pus, then use soap and clean water. Wear protective gear as required. Fever, if infection spreads into deeper tissue, cover with medicated cotton or bandage. Repeat the dressing and clean the part every day till it heals up completely. Abide rule and regulations of sports activity. Redness, keep it dry. Dirt should not enter the wound. Maintain playfields and courts. Pain or sore to touch, if severe injury, patient should be taken to doctor immediately. Unbiased officiating helps in preventing injuries. An external injury. Cuts made by sharp objects, blades of knife. In this, blood vessels, capillaries can get damaged. Laceration. An external injury, a direct blow on the skin causes the skin to tear off, especially from point where bone structure underneath are of prominent. Symptoms treatment prevention. Bleeding occurs from affecting part. Clean the surface of the affected part and stop bleeding at the earliest. Proper warm-up should be performed before training competition. Severe pain occurs at the affected part. Apply ice or cold compression. Wear protective gear as required. If injury is deep, go to the doctor for stitches at the earliest. Abide rule and regulations of sports activity. Take good care of injury till complete healing. Maintain playfields and courts. Unbiased officiating helps in preventing injuries. Contusion. An internal injury without external bruising caused by the blow or impact, without breaking or rupture of the skin. Symptoms treatment prevention. Discoloration under the skin, which starts from redness to turning blue. Treat immediately with ice application for some duration. Proper warm-up should be performed before training competition. Swelling and pain on affected part. In case of swelling, anti-inflammatory medicine should be given. Wear protective gear as required. Stiffness over the area. After 2 days, massage should be done over the affected area to reduce swelling. Abide rule and regulations of sports activity. Unbiased officiating helps in preventing injuries. Sprain. An internal injury of ligament at the joints like wrist joint, ankle joint, etc. caused due to overstretching or twisting of a joint. Symptoms treatment prevention. Swelling and softness at the affected area due to internal bleeding. Apply ricer treatment. Maintain a healthy, well-balanced diet to keep muscles strong. Acute pain on touching the affected area. Take medicine, painkiller if required. Maintain a healthy weight. It restricts the movement of a joint. Practice safety measures to help prevent falls. Wear proper shoes. Do warm-up and stretching regularly. Be in proper physical condition to play a sport. Strain. An internal injury of tendon muscle caused by the stress over the muscles or overstretch them beyond its normal limit. Symptoms: treatment, prevention: swelling, inflammation, or loss of function at the affected area. Apply ricer treatment. Maintain a healthy, well-balanced diet to keep muscles strong. Acute pain on moving the body parts such as arms or legs. Take medicine, painkiller if required. Maintain a healthy weight. Feeling as something broke inside, practice safety measures to help prevent falls. Wear proper shoes, do warm up and stretching regularly. Be in proper physical condition to play a sport. Bone injuries. Different types of fractures. Symptoms of fracture: swelling and pain occurs in affected part, change in the shape of the bone, bruise in between the broken part, pause in the movement of the part, cracking sound in the bone. First aid for bone injuries: immobilize the injured body part and keep patient at comfortable position. Provide support by using sling or bandage. Apply cold compression by ice packs to reduce pain and internal bleeding. Simple fracture: bone breaks but not the skin over it. Close wound fracture. Multiple compound fracture: both bone and skin break. In this, infection bacteria can be created. Open wound fracture. Comminuted fracture: bones has splintered, shattered, usually going through a crushing injury, blood vessel or associated. Green stick fracture: break occur only part way through the bone, occur in young child more. Impacted open fracture: when the broken ends of both the bone drive into one another. Due to mishandling also it happen. Stress fracture: hairline frac is an overuse injury which occurs when muscle become fatigued and not able to absorb more shock work. Oblique fracture: direction of breakdown is diagonally. Transverse fracture: direction of breakdown is horizontally, in which the bone is displaced horizontally from the normal position. Complicated fracture: when the broken bone injures the delicate part of the body. Joint injuries. It is an injury of joint in which adjoining bones are displaced from their original position. Dislocation is when position of bones in joints are altered. Dislocation may be caused due to direct or indirect impact over the joint. It may be simple fracture, complicated dislocation. Dislocation is common in throwing events but can be prevented by strengthening muscles, warming up, etc. Types of common joint injuries. Dislocation of lower jaw: generally, it occurs when the chin strikes to any other object. It may also occur if mouth is opened excessively. Dislocation of shoulder joint. Dislocation of shoulder joint may occur due to sudden jerk or a fall on hard surface. The end of the humerus bone comes out from the socket. Dislocation of hip joint. It may occur due to putting maximum strength spontaneously, which causes the end of femur bone is displaced from the socket. Dislocation of wrist. It may be caused due to miscalculated landing or while breaking the fall. It is common in various sports, i.e. in football, ice sports like hockey and skating. First aid for joint injuries. Keep the patient in comfortable position which he/she wishes to assume. Movement is restricted to avoid further complications. Injured part is supported by use of slings and bandage. Apply ice pack to reduce swelling and to reduce pain. Patient should be transported to nearby hospital in a comfortable position. The immobility should be for 3 to 6 weeks. Patient should be handled by an expert doctor performing X-rays and other diagnosis and apply plaster so as to enable the joint to take its real position. After full treatment, progressive rehabilitation exercises should be followed to restore the strength of joint.